Knock, knock. Hi, good morning. My name is Kate. I'll be your nurse today. So I'm going to provide privacy, wash my hands. Can I have your name, date of birth?
Stephanie Serrano, August 7, 1999.
Good. Do you have any allergies?
No.
Okay, good. I'm going to ask you some funny questions. Do you know where you are?
Yes, I'm at the hospital.
Do you know why you're here?
Get checked up.
Do you know what day it is?
July 28th.
Do you know what time it is?
Morning.
Okay, good. So patient is alert and oriented ×4. And what is your mood like today?
Happy.
Okay, good. Now I'm going to just let you know that I'm going to do a physical on you. This will take about 15 minutes. Do you need to use the restroom before we begin?
No.
Okay, good. So I'm going to start with your head. I'm going to put some gloves on. Okay. Check for any lumps, bumps, bruises. Do you feel any tenderness when I do this?
No.
Okay. Head is round. Hair distribution is equally distributed. I'm gonna then check your neck, inspecting. Okay. I'm gonna check your trachea, palpate your lymph nodes. Gonna palpate your lymph nodes posteriorly. Can you swallow? Okay, good. Lymph nodes are non-palpable. Now I'm going to be checking preauricular, postauricular, occipital, retropharyngeal, submandibular, and submental, anterior cervical, posterior cervical, and subclavicular. Okay. Can you turn your neck to the left? No lymph nodes on, no JVD in the right, the other way. No JVD in the left. Can you move your head towards your shoulder without moving your shoulders? Good. Can you extend it back? Flex forward. Can you rotate your head? Good. So range of motion is intact. Can you raise your shoulders? Okay. Down. Again. Okay, good. Cranial nerve 11 and 10 is intact. Okay, now I'm going to begin with your ears. I'm going to check for any drainage, redness. Good. Okay, I'm going to check your hearing. So I'm going to ask you to close one ear and then repeat what I say back to you, okay? Red, blue, boy.
Red, blue, boy.
Good. Green, girl, yellow.
Green, girl, yellow.
Okay, good. I'm gonna ask you to stand. I'm gonna test for Romberg. Okay, you can open your eyes. Now close them. Okay, mild swaying, which is normal. And then I'm gonna ask you if you can walk forward and come back, testing for gait. Okay, you can sit down. Gait is normal and cranial nerve 8 is intact. Okay. Now I'm gonna check your mouth. Say oh. Okay. Uvula is in midline. No abnormalities, no bleeding gums, no inflammation. I'm gonna test your gag reflex. Gag reflex is present. Can I ask you to stick your tongue out? Move it side to side. Stick it out. Move side to side. Okay, move up and down. Okay, good. Puff your cheeks out. Good. Okay. Cranial nerve 9, 10 is intact. And 12. Okay. So now I'm going to check your nose. Okay, no redness, no inflammation. I'm gonna test your smell. So if you can cover one nostril, close your eyes, and let me know what you smell. Okay?
Vanilla.
Okay, other nose.
Strawberry.
Okay, good. Now I'm going to test for your eyes. So the tech had already done your Snellen chart, which was cranial nerve 2, as well as your vitals, and everything looked great. Okay? Just look straight at my nose. Okay, pupils are equal, round, and reactive to light. Now I'm going to test your cardinal fields of gaze. Just follow this pen line. Now testing for accommodation. Okay, good. Cranial nerves 3, 4, and 6 are intact. I'm gonna ask you, can you raise your eyebrows? Okay, can you smile? Can you frown? Okay, good. Now I'm gonna test for resistance. Just press against my hand. Okay, good. And then I'm gonna ask you to close your eyes. And let me know when you feel touch.
Touch, 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 touch.
Okay, cranial nerves 5 and 7 are intact. Okay, great. Now I'm gonna go down to your chest area. Now I'm inspecting, no abnormalities, chest is normal, no abrasions, no lesions. Patient is breathing normally, no use of accessory muscles. Now I'm gonna check for your breathing. Just breathe in and out every time you feel this at this go. Okay, good. Breath sounds are normal anteriorly. I'm gonna check posteriorly. Okay, breathe in and out. Checking laterally. Okay, good. Now that you're sitting like that, I'm just gonna check for your respiratory expansion. Just take a deep breath in and out. Good. Okay. I'm gonna check anteriorly. Breathe in and out. Okay. Respiratory expansion is normal bilaterally. Now I'm going to auscultate your heart sounds. We have aortic, second intercostal space, right sternal border, pulmonic, second intercostal space, left sternal border, Erb's point, third intercostal space, left sternal border, tricuspid, fourth intercostal space, left sternal border, and then your mitral, which is fifth intercostal space, mid-clavicular line, and we would listen here for 1 minute. Okay. Heart sounds are normal. Now I'm going to check your arms. Everything looks good. No abnormalities, no lesions. Check for edema. No pitting edema. Check your radial pulses. Your brachial pulses. Good. Seen bilaterally. Check your capillary refills, less than 3 seconds. Now I'm going to compare your carotid with your radial. Okay, good. And check your carotid one more time. Good. Okay, I'm gonna check your deep tendon reflexes. Just have your arm out. Checking your biceps, checking your triceps, and your brachials. Okay, good. Now checking biceps, tricep, and brachials. Good. Okay, can you rotate your arms? Can you push them forward, to your side? Good. Range of motion is intact. Now I'm gonna test for strength. Can you go like this? Okay. Press against me. Okay, good. Now the other way. Okay, good. Strength is intact. Also, can you squeeze my hands? Okay, good. Good job. Okay. So now I'm gonna ask you to sit down. Lay down. Okay, so before I inspect your abdomen, when was the last bowel movement you had?
This morning.
Okay, was it normal? Did you see anything abnormal?
It was normal.
Okay, and last time you urinated?
This afternoon.
Okay. Was it normal? Did you have pain while urinating? Was it a weird color, odor?
No. No.
Okay.
Yeah.
Good.
Normal.
So I'm gonna inspect the stomach. Stomach seems to be flat. No abnormalities, no lesions. Okay, so now I'm going to auscultate. I'm gonna listen to your 4 quadrants, starting with your right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. Okay, good. Sounds are normal. I can hear them. If I wouldn't be able to hear them, then I would listen for 5 minutes. Now I'm going to percuss. Right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant. Good. And I'm going to lightly palpate. Let me know if you feel any pain.
No pain. No. No. No.
Good. Okay. And now I'm moving down to your lower extremities. Can I ask you to raise your right leg up? Good. Left leg. Good. Raise up again, testing for strength. Good. Up. Go down. Good. Up. Okay. Down. Good. Okay. See no edema, no abnormalities. Color is normal, equally distributed. I'm gonna ask you to point your feet, your toes down. Okay, that's for plantar flexion, point up, dorsiflexion. Great. I'm gonna ask you to put your heel of your foot up to your knees. Good. Other one. Okay, good. I'm gonna see your dorsalis pedis. Pulse is bilateral. Now your posterior tibialis. Pulse is bilateral as well. I'm gonna test your capillary refills. Okay, less than 3 seconds, just like your hands. Okay, now I'm gonna ask you to sit back up. And I'm gonna test your deep tendon reflexes here in your patella. Good? Good. And lastly, I'm gonna ask you if you can put your hands here and just move them back and forth as fast as you can. Okay, good. So I'll give the results to your doctor and he should be back shortly.
Thank you.
Thank you.